Alrighty. So we are going to record this webinar. So folks, if you need to come back later on for this information, you'll have the recording. We'll mail it out to folks. We'll do a little bit of introductions and then I'll turn it right over to Erica to get started on the information. So my name is Angie Railing. My pronouns are they, them, and I am a prevention coordinator here at WCASA. I'll let my WCASA colleagues introduce themselves.
Good afternoon, everybody. My name is Nestic Morris, and I'm the outreach coordinator at Wakasa.
Hi, everybody. I am Vanessa Moss, she, her, and I am WCASA's Administrative and Trainings Coordinator.
All right. So we are super excited to have a conversation, as weirdly as that sounds, talking about suicide intervention and prevention. I feel like this is a conversation we don't talk a lot about. There is a lot of stigma around mental health just in general, and a lot of stigma around talking about the feelings of suicide. So the way to break that stigma is to actually have these conversations and talk about it. And so, very excited to have Erica, who's doing amazing work across the state of Wisconsin on suicide intervention and prevention. I will turn it right over to Erica to get started. If you have any questions, please don't hesitate to put them in the chat. You're also welcome to unmute yourself at any time. If you do want to ask questions anonymously, you are absolutely more than welcome to send any of those questions to myself or my WCASA colleagues. I'm not sure if Erica's going to be able to see the chat and things while you're sharing, but that is always an option as well. All right. Thank you, Erica. Thank you so much for being here.
Yeah, thank you so much for having me. Hello, everyone. I'm Erica Steib. I'm the State Suicide Prevention Program Manager at Mental Health America of Wisconsin. I use she, her pronouns. And yeah, very happy to have been invited to the space to talk about suicide prevention with you all. I definitely see some familiar names in the participants list, so it's good to see some folks. And yeah, nice to meet some new people. Um, so today I'm gonna kind of talk about suicide prevention starting from the bigger picture, like macro scale, talk a bit about our public health approach to suicide prevention in Wisconsin. And then the second half of the presentation, I'll get into some best practices for actually talking about suicide with people who are struggling. And throughout the presentation, I'm definitely open to like questions along the way. If you want to put them in the chat, I'll try to check it while I'm also screen sharing. Sometimes Zoom is a little hard, so I'll do my best. But other Wakasa folks, if you want to just like shout out, I'm open to that too, because otherwise I'm just talking forever. And there will also be a point later where I'll invite some like suggestions and ideas that you all have from your own communicating with people about suicide and difficult feelings. Like there will definitely be like some interactive parts towards the end. So, a little bit about me. Like I said, I work at Mental Health America of Wisconsin. I've been in suicide prevention there since fall of 2019, where I started as an intern. I was interning as part of my public health field placement at UW-Milwaukee for a master's in public health. And before that, I studied psychology and LGBT studies. And yeah, just happened to find my way into suicide prevention. It's kind of a niche field, even though it definitely touches like all aspects of society and public health, but it's not a very big field. Most people don't necessarily seek out that kind of work, but as someone who's always had a personal relationship to suicide, both like my own thoughts and feelings and self-harm, but also suicide loss within my community. It's definitely an area that I've always been interested in, and mental health is a topic that I was just always passionate about. And yeah, ended up here. Another aspect of my work, and maybe something you all have heard of at some point, is the PRISM program, which was a peer support program for LGBTQ youth. We started in about 2020 and is unfortunately on hiatus right now as of 2025. But that peer support space is another important aspect of my work and something that I still continue with in certain respects. This photo is actually from an Alternatives to Suicide facilitator training that we did last year that was really successful. And so building out those kind of peer support groups across the state has been a really exciting area of work, and that's also a space I facilitated. And I'll talk about those groups a little bit later too. So Mental Health America is where I work. I'm going to talk a lot more about Prevent Suicide Wisconsin, which is our statewide coalition for suicide prevention. But just wanted to shout out some other resources that MHA has. MHA is based in Milwaukee, and we have a wellness clinic there that provides mental health services to families as well as adults and youth. We're also in schools in the Milwaukee area. But as an organization, we also work statewide, like through suicide prevention, through different aspects of our peer support work. We also have the R&R House, which is the first and only peer-run respite for veterans in the country. That's been operating for like 6 or 7 years now as well. And yeah, we also operate a warm line and a virtual support group for veterans who are another group that's at disproportionate risk for suicide. And yeah, there's other resources listed on our website. I'll make sure to share these slides out after today so that it can get emailed to those of you who registered so you have all these resources. But yeah, MHA has a lot of virtual support groups as well, and I'm going to touch on those later as well. But just know that those are available if you or anyone you work with could benefit. So Prevent Suicide Wisconsin is our statewide coalition for suicide prevention, and MHA is through a DHS contract. We are tasked with convening PSW um, and our annual conference, as well as our steering committee and other public and educational events. We do an annual zero suicide training, which is for healthcare systems. We update the state suicide prevention plan every 5 years. I'm going to talk about that quite a bit today. And generally try to foster collaboration across the state for suicide prevention. As a body, PSW contains representatives from public health, research, local health departments, state agencies, advocacy groups, peer services, representatives of different at-risk groups like veterans, LGBTQ folk. And really, PSW is open to anyone who's interested and ready to commit to that public health approach to suicide prevention. We really feel that every sector of society has a role to play. People working with all different kinds of populations across the lifespan. And so if that's something you're interested in, definitely recommend signing up for our e-newsletter, checking out our website. We try to, keep it updated with a lot of different events and resources that are happening. Yeah, and our annual conference is going to be in June this year. And that's a really good way to learn more about what's happening in our state and learn about different best practices for prevention. It's going to be, we have an in-person day on June 15th in Madison, where we have a safe side training, which is really an excellent framework because it can be applied to a lot of different settings. And then on the 16th and 17th, we have the virtual conference, which is online through Zoom and have a ton of different content there. And yeah, we'll definitely be sure to share this out later, but something to consider. And again, very open to anyone who is serving different communities and anyone with a commitment to suicide prevention. So I just wanted to touch on language briefly. We can really do a lot to shift the culture around suicide and around mental health through the language that we use to normalize it and destigmatize it. And so some of this might be, old news to you, but just as a refresher, and because for some folks it is new, but as a field, we try to get away from certain stigmatizing language like committed suicide is a phrase that kind of comes with connotations of like committing a crime or a sin. And so as a field, we've been trying to move more towards like died by suicide, died of suicide as a way to normalize it. We don't talk about suicide attempts in terms of successful or unsuccessful or complete or incomplete. Really, we just talk about suicide deaths or attempts. I think that's another important just thing to be mindful of because we never want to, convey that like there's like success in suicide. We also want to be careful not to like place judgment on people's behavior when talking about suicide and mental health. So we try to talk, just describe people's behavior rather than labeling them as manipulative or attention seeking, or like cry for help. We just want to, again, try to be neutral and objective when we're talking about, the experiences that people are going through as they're contemplating suicide. And we try to get away from limiting people's experiences to their like mental health diagnoses. So we try not to say like they're borderline, they're schizophrenic, try to use the language of like diagnosed with. Um, and we always want to talk about the people we're working with, not people that we're like dealing with. Probably this is yeah, not news to a lot of you if you are working with survivors and trying to support people through really difficult situations and trauma. That trauma-informed language, I'm sure, is not new to y'all, but just like to kind of point that out because it's just, again, another way we can destigmatize these topics. And just as a field, like that's kind of where we're trying to go. So suicide as a public health concern is an approach I think that's taking on a lot more acceptance in recent times, which is really good. It's no longer thought of just as like a solely a mental health issue. And we're going to talk a little bit about what that means and like how we can intervene if suicide is not really only a mental health problem. But in the public health realm, we talk about the social ecological model, the individual, relationship, community, and societal and policy levels, where there are risk and protective factors at every single one of those. And suicide is a global public health concern. It is present in really every country. It's estimated that 700,000 people die by suicide globally each year. And in the US in 2023, which I think is still the most recent data we have for the whole nation, it was estimated about 50,000 people died by suicide. And so each suicide death obviously comes with a lot of grief, a lot of ramifications on relationship and community and societal levels. And those effects can't be quantified, right? And so it is a complex issue. There's a lot of different contributing factors. And to really move the needle on suicide prevention, we need to think about all the different social determinants of health that can impact people's ability to see a future for themselves. I really love this graphic. I always like to share it in presentations. This is by an artist named Elise Veriani, who is someone with lived experience of suicide, as well as an art therapist based in Chicago. But yeah, we as a field need to consider like all the underlying factors that contribute to people's distress. And so the medical model is kind of like at the top of this like illustration of like the soil and the earth. So the medical model is like the narrative that that distress is a result of like a biological flaw or like imbalance, or like the framing that like suicide is always a result of mental illness. And while there is obviously like some truth in that mental health diagnoses like can be a contributing factor to suicide, but it's far from the only cause. And when we only focus on the medical, the biological explanations for these issues, we miss out on all the other factors, a lot of which are social factors and factors of power imbalances. And we miss out on so many opportunities to really create conditions where people actually can thrive and live and see a future for themselves. And so I just love all the different ways that this illustration names like racism, injustice, trauma, transphobia, homophobia, these things that are like, social issues that aren't really a result of like mental illness, white supremacy, environmental risk factors, colonization, food insecurity, all these things that can't really be solved just with like therapy or medication. And so, yeah, I just love to think about that when we're also thinking about suicide and suicide prevention and how do we actually create a world in which people can live and people can thrive. We need to be able to address all of these very real risk factors. Okay, so turning to the Wisconsin Suicide Prevention Plan, this is our latest state plan. This cover here, it was released in September 2025. Wisconsin's been publishing suicide prevention plans since about 2002. Um, and yeah, very exciting to have a newly updated document with updated data and updated prevention strategies and resources. This is a resource that's meant to inform any work to reduce suicide attempts and deaths in Wisconsin. This state plan is really something that we try to design it in a way that it can be used by all kinds of professionals, whether it's people who work in suicide prevention directly or crisis services, but also educators, public health, other kinds of healthcare providers like primary care, um, uh, pediatrics, etc. We want to reach anyone who's serving youth, anyone who's serving different like populations and communities, veterans, Native Americans, LGBTQ folks. We also kind of frame the state plan in a way that is like very aspirational and practical. Yeah, I'll kind of touch on some different aspects of the plan today, but I would also encourage y'all to check it out if this is a topic that interests you, because I really think there's something in there that anyone can pick up and apply in their work. We include goals and action steps as well to get a little bit more specific about like how we as a state can advance these things. So I'm going to share a little bit of Wisconsin data points. Hold on, I'm going to check the chat real quick. Yeah, the graphic. I love that one. I use it all the time. So yeah, Wisconsin data. I know data can be a little bit of a snooze sometimes, so I'm just gonna do like really high level because I do think it's important for us to know what it looks like in our state. So the most recent suicide death data that we have is 2024. And in 2024, there were 925 Wisconsin residents who died by suicide, and it's been kind of around that number for the last 5 years. Um, and so the age-adjusted suicide rate in Wisconsin over the 10-year span of 2014 to 2023 actually increased by 15%. So modest increase, but still significant. Comparing by sex, males die by suicide at a far greater rate than females. It's about 3 times as high, and that is the age-adjusted rates as of 2023. Comparing by race, we combined data for the 5 years of 2019 and 2023 and saw that Native Americans have the highest age-adjusted suicide rates, followed by white Wisconsin residents, Black, Asian Pacific Islander, and then 2 or more races. By age group, the suicide rate is highest among ages 45 to 54, but it does impact almost every age group, and especially that middle age to older adult age tends to have the higher rates. Um, Rural counties in Wisconsin have much higher rates than in urban counties. We also see that veterans account for 1 in every 5 suicides in Wisconsin. Again, disproportionate to their what's the word? To their portion of like the overall population. They are overrepresented in suicide deaths. In 2023, over half of all suicides were by firearm, followed by suffocation as the next most common method. And males were also twice as likely as females to use firearms. For youth in 2023, the youth suicide rate we were looking at ages 10 to 19 was 6.4 per 100,000. And for youth, they tend to have the lowest rates compared to like all the other age groups. But suicide is the second leading cause of death for youth. And that has been the case for quite some time, I think, for the last couple decades. And that tends to be roughly the case nationally as well. And so, youth suicide is obviously still a major issue because we see how like out of all the premature deaths that youth are facing, this continues to be the second leading highest. Females ages 15 to 17 have had the highest rates of emergency department visits and hospitalization for self-harm. And then the second highest group was females ages 10 to 14. And so we include some data on self-harm in the state plan. And we have to be careful because we don't want to assume that there's always suicidal intent with self-harm. Sometimes there is, but for many people, self-harm is also a coping mechanism and something that they choose, over dying by suicide. But it's still very much a concern. It's very much something that can, lead to serious injury and degrade people's quality of life, and obviously just like come with a lot of trauma. So definitely still something we need to take seriously and kind of ask ourselves like why these young girls always have these disproportionately high rates compared to every other group. And then among youth, we get a lot of self-report data from the Youth Risk Behavior Survey that lets us get like a very clear picture of what the youth are experiencing themselves from their own perspectives. We see that 18.6% of youth have considered suicide in Wisconsin, and 14.9% have made a plan to attempt suicide. And the rates are especially high among lesbian, gay, and bisexual youth. And among we also see higher rates of suicide attempts and plans, as well as higher rates of depression and anxiety among girls compared to boys, among Black and Latino and multiracial students compared to white students and compared to the average. I also wanted to highlight one data point that we included in this last state plan that really stuck out to us from the YRBS. And so among students who experienced sexual assault or coercion, we saw that 47% of those youth considered suicide, 39% planned suicide, and 31% attempted suicide. And as well dealing with much higher reports of self-harm and depression and anxiety too. And so this is, again, I think another really important like opportunity for the field to consider when we're thinking about like suicide prevention among youth. Like there's clearly like a whole like subsect of that population that is dealing with particular traumas around sexual violence, and to really again try to move the needle on youth suicide and youth mental health struggles. We need to really try to link, I think, the sexual violence advocacy space and the suicide prevention space. And I'm sure that's something you all have been thinking about too. And so these are just the data sources that we use for the state plan. We do have in Wisconsin a suicide data dashboard and a self-harm data dashboard that gets updated on an annual basis. So if you're ever interested, I would definitely recommend checking out those dashboards. You can get other kinds of data from that too. And I also, whenever I share about data, I like to just kind of note that there's a lot of opportunities for improvement in suicide data collection. Unfortunately, like there's a lot that gets missed in the ways that death is investigated and reported. There's a lot of data we just miss out on. There's a lot of inaccuracies in reporting race and gender, sexual orientation. We actually don't collect data on sexual orientation, occupation, disability, or veteran status. So again, things that would be really helpful to have so that we get an even clearer understanding of like who is dying by suicide, what occupations and other like life experiences are associated with that. And yeah, especially with gender too, like it's just death is recorded on a binary gender in Wisconsin, and so we miss out on gender nonconforming people, and sometimes people's gender is just like marked wrong. Yeah, based on who's filling out that investigation. So the suicide prevention plan in our state plan is organized into 3 tiers, and I'm gonna touch on these a little bit just to again kind of give you a picture of like what work is being done and where the opportunities are. So our tier 1 is community-based prevention, and so that is about promoting mental health, suicide prevention, and postvention in the places we live, work, study, worship, and age outside of formal care services. So we think of this, as a much more upstream prevention trying to create conditions where people live that promote protective factors, where we can intervene on risk factors, and generally try to help people build a life that they want to live and develop, healthy relationships and coping skills and everything before the point of crisis. That's where we can really try to make the biggest impact, as well as that's where there's I think a lot of opportunities to fight for better conditions so that people have basic necessities of life as well, the things that they need to live and thrive. Tier two is about prevention and intervention across the continuum of care. So that's referring to more formal care services, health and behavioral health systems. And so that includes, yeah, anything from crisis services to physical health care, um, social work, case management, peer services, the whole range of like formal care services. And tier three is about data collection and program evaluation. So that's about building capacity in local and state partners to improve data on suicide in our state. And promoting program evaluation to build our collective understanding of what's working in suicide prevention, what we can continue to reproduce, and just building our collective understanding of what works. So I'm just gonna again kind of briefly go through these. I would definitely recommend if you're interested reading our state plan, if you want to know more, because there's a lot of action steps and resources that support all of these. But yeah, under community-based prevention, this includes activities related to facilitating social connection, bringing best practices into the places we live, work, study, and worship. So there's little subsections about like schools, about the workplace, about faith communities. There's a lot of ways we can kind of build in some of these best practices in the places where people already are in order to, yeah, promote those protective factors. Public knowledge of suicide includes like trainings, like messaging campaigns, things like that. Lethal means safety refers to uh, creating safety, creating a little bit more time and space between people who are struggling and the means that they might use to die by suicide. So, firearms and medications, especially, because we know that, there are oftentimes people can be in an impulsive situation where they are thinking of suicide, where they have access to firearms, to medications. And if we can create a little bit more time and distance between them, that can make all the difference in saving people's lives. Adverse and positive childhood experiences fall under this tier. ACE is obviously increasing risk for suicide later in life, but positive childhood experiences on the flip side can also kind of build that buffer against those adverse experiences. We also include social emotional development, again, kind of geared towards that developmental, building positive coping skills, relationship skills, and habits that can support people across the lifetime. Postvention includes supporting people and communities after someone dies by suicide to try to mitigate the contagion effect that can sometimes take place in social networks. And then suicide prevention coalitions, so like the grassroots, local level work to advance these different strategies. Prevention and intervention across the continuum of care. This tier includes best practices in the healthcare behavioral health systems. The zero suicide framework is a quality improvements approach to safer suicide care in clinical systems. It includes many different elements related to like data collection, policies, training, organizational culture. Um, Again, really to standardize how standardize the care that people receive when they're in different healthcare systems when it comes to suicide. The same way that there are standards of care for like cardiovascular problems, like care pathways that are established well ahead of time when someone, enters a healthcare system with those kinds of problems. We want there to be that same kind of like standard and pathway to care when it comes to suicide too. That also includes care transitions, helping support people as they navigate different levels of care, different kinds of treatment. The Wisconsin crisis system falls into the continuum of care, so providing people in crisis and their families with the right care at the right time in the right place. So that includes 988. That includes 988 is the National Suicide Prevention Lifeline. That also includes local level crisis support, mobile crisis, um, and things like that. Peer support falls under the continuum of care as well, and expanding access to the continuum of care and addressing barriers for underserved areas and marginalized communities. And then data collection and program evaluation. Some of the goals under this tier include utilizing and promoting Wisconsin data to educate on suicide, as well as improving our data collection practices, kind of like how I mentioned before, trying to fill some of those gaps and improve upon the data that we have so that we have a clearer picture. In standardizing and enhancing capacity for death investigation and reporting suicide deaths. So on the local level, there are suicide death review teams in, I think, like 12 counties in Wisconsin. Those review teams, sorry, my cat. Suicide death review teams review local suicides within the last year and kind of walk through the precipitating events that led up to that person's death in order to try to identify opportunities for improved prevention. So that's a really good way on the local level to kind of understand maybe some of the conditions that people are living under and like maybe areas for improved education and training and preparation. Promoting and supporting research on suicide prevention, and evaluating prevention activities to identify strengths and gaps and to determine if they're having their intended effects. So yeah, again, definitely recommend checking out our state plan if you're interested in these things. I really think that there's a way that every single sector, every single profession can plug into this like bigger picture. Okay. Before I get into the second half, I talked for a long time. Is there any questions or comments about any of the Wisconsin suicide and prevention strategies?
I don't think we've gotten any, but we will send out, I'm sure it's linked in your slides, Erica, but we will send out a link to that state plan. And I know feel like there's a lot of connections between sexual assault, sexual violence prevention, and suicide prevention. We're
Mhm.
trying to change the conditions in the world where sexual violence is more likely to occur. We're also
Mhm.
trying to change the social conditions in our world where people's decision and mental health is prioritized. So there's a lot of connections here. So I'm hoping that folks can take the plan and maybe integrate it into some of their prevention work and advocacy efforts that they are doing with the survivors that they're working with.
Mhm. Yeah, no, I so appreciate that. Yeah, I know it's like this like self-inflicted violence of suicide as well as interpersonal violence, sexual violence, like they are not separate from the systems that we live in, the systems that we work in. And yeah, I think that there are a lot of like power imbalances at play in both, honestly. And I think like yeah, it's really important that we take this like bigger picture approach. So we're not just constantly handling the symptoms of these things, right? Like we're trying to get to the root causes of them. Any other questions or comments so far? Yes, Anna was just about to echo that. Yeah, yeah, absolutely. Yeah, I'm sure you all find that in the work that you're doing, like seeing the overlap. Yeah.
And as I mentioned, like before we started, like just having conversations and saying the word suicide, talking about mental health, that is a huge step when you're working with survivors to have conversations about the trauma that they experienced and how they can access services to help their healing journey from the trauma that they experienced. So this could be a huge part to the crisis work, like you just said, Anna, the work that you're doing with survivors is having these conversations.
Exactly, yeah. Cool. Well, let's get into the second half then, because this is where we're going to talk a little bit more about, how we actually talk about suicide with the folks we're working with. And yeah, I'm going to talk a little bit more about like where this framework for these kind of conversations come from. But really, like, I really appreciate this quote for Brene Brown. The truth is, rarely can a response make something better. What makes something better is connection. And like I know that might seem like simple and maybe, to some of you like this is how you think about suicide prevention. This is how you think about supporting people. Unfortunately, there have been a lot of um like suicide prevention trainings that kind of frame the whole like question around like um how to respond, like how to save lives like at all costs, like in kind of approaching from like a place of urgency, approaching from a place of like this is the problem, right? Like suicide is the problem. And the reality is for people who are thinking about dying, like suicide is actually not their problem. Like that to them, that is their solution. Like there's so many other problems that are leading them to feel like that is the only solution that they have, that is the best outcome for them. And so we want to shift away from just like responding, shift away from just like intervening and shifting more towards connection because connection is what actually can build safety in the moment. Like in the one of the things that struck me the most when I took an alternatives to suicide training was this maxim that they use, which is pain witnessed is pain transformed, and that is very different than just like trying to like look out for like certain signs and then like setting people on some like path of like referral to get like help from someone else, like passing people off to someone else. But really, we all have a capacity to create uh create safety for people through the ways that we connect with them, through the ways that we listen to them, through the ways that we witness their pain. Which also, like, again, it can be easier said than done. Which is why, why we do trainings like this, why, we practice these kinds of dialogues before we're in those conversations because it can be very stressful. It can be, very scary and bring up a lot in us when we witness someone else's pain. But there are ways that we can slow down and like hold space for these conversations. And that's really like one of the most important protective factors that we have that really absolutely everyone can do, not just like, quote unquote mental health professionals. So Alternatives to Suicide is a framework, a peer support framework from an organization called the Wildflower Alliance, which is based out of Massachusetts. They've been doing really amazing work in mental health and harm reduction for many years. And so since 2007, Wildflower Alliance has hosted healing spaces, peer support groups for suicide, for conversations around suicide and despair in ways that rarely happen. There's not a lot of places where people can openly talk about suicide without there being some kind of like protocol for what happens to them after they talk about it openly and honestly. And that's, I think, a big reason why people are very hesitant to talk openly about that because they are afraid of what can happen. And so Alternatives to Suicide is the approach that grew out of that work. And it can be applied to a variety of settings that involve speaking about, sitting with, understanding, and moving through thoughts of wanting to die. And so Alternatives to Suicide, or Alt to Sue, I say that for short, it is actually like a peer support group model. And so we have these Alternatives to Suicide groups in Wisconsin and a few different places across the state. And we also have a virtual group. And yeah, we really learn and apply this approach from Wildflower Lines. But the framework, this kind of framework for communication that we're going to go over today, it's called VCVC. This can be applied really in any space. So it, again, like Alt2Sue is it originated from like peer support groups, but it's definitely like the principles and the framework can be applied in one-on-one conversations. It can be applied in a lot of different places. And so I definitely recommend people checking out Wildflower Alliance. They're really a great organization, and they also do in-person and virtual trainings around this approach. They have Altissu trainings that are like scaled down to like overview workshops that can be really good for like an organization. They can do the facilitator support group facilitator training, and they've also adapted this for youth as well, which is really cool. So yeah, definitely recommend checking them out. Always want to be sure to credit them because the content that we'll get into is actually an adaptation of their framework. So this, I know this is a lot of text on this image, but this comes from the training directly, and I think it's really powerful because we want to not assume what people mean when they say they want to die, when they say they, wish that they had a way out, when they say they're suicidal. We really don't know unless we ask, unless we talk to people. So people might say, I'm suicidal because I'm thinking of killing myself. But people could be saying, I'm suicidal because I've learned that no one listens to me unless I say that I am. Or I've learned that if I say this, I get access to resources that I wouldn't have otherwise had. Um, or I might be just like having such big emotions, so much overwhelm that I cannot describe. And it can be a shorthand, right? And people, have that desire to die for so many different reasons. Like it's never just one thing. It can be because of just so much unresolved anger at injustice, at violence, of trauma. It could be because of physical chronic illness and pain that doesn't seem to have an end. It could be because of things from the past, of shame, of wanting to be with someone that we've lost. It could also be, some people have this desire to die, and it's also kind of a comfort. It could be, this idea that like I have a way out, like I have another option, and that's what keeps me going. And people, for many reasons, might choose other things besides suicide, but just knowing that that's there is a source of comfort for some folks. And so we just never want to assume like one kind of meaning because if we assume, then we are also like leaving out so many opportunities to actually like explore with people the meaning of these feelings, the meaning of these experiences, and also where they want to go, like what they would define as a life worth living. So the VCVC framework is kind of summarized here. And we're going to walk through each component. And again, this is just kind of a framework and approach. It's not really meant to be like a linear, like step-by-step process, but of course, like it can be helpful. Humans like acronyms. And I think in Altissu, it just yeah. The trainer Caroline always like jokes about how like people were like really pressing them for an acronym, and she was like so hesitant and resistant to that because like you really can't like have a play-by-play book for how to have like conversations about really big hard experiences with people. But of course it can be helpful as a framework to have something to kind of fall back on. So um, validation is the first part of the framework, and the goal of validation is really just to show people that you see them, that you accept them, and that their experiences, their feelings, their concerns make sense. And sometimes validation if is like just like a really key ingredient that people just don't get enough in their own life. Like people are often told in a lot of different ways that they are wrong for feeling the way that they're feeling. And that's, incredibly tiring. That can really uh really degrade people. And so sometimes in conversations, especially if it's like a short conversation with someone, like you could do a lot just by validating, just by like really listening and actually like reflecting to the person that like you see them in their pain, and that you accept it and that it's okay. Curiosity being the next component. That's about showing the individual that you value their story, that you see them as a whole human, and that you care about the context of their life. and also asking questions in a way that shows the person that you see them as the expert of their own experience. Again, it's actually can be so harmful for people to kind of just be asked the same kind of checkbox questions. I think that's how sometimes people can feel in like when they're going through these like clinical risk assessments. And so curiosity is really getting at less about the questions of like yes or no, like are you thinking of suicide? Although like yes, that is a good question to ask, but I'm really getting at like the why and trying to get deeper into what that experience really means for them. Vulnerability is about sharing a little bit about yourself to build that connection. So vulnerability is about sharing a little bit about yourself, about what you've been through, about your own struggles, your own strengths, showing them that you trust them with that. And that's a way to also just create space for more sharing, for deeper connection. And then community is about showing people that we are not alone, that our connection exists in a wider community to help people see that they are not the first or the last person to deal with what they're dealing with, and that there is hope, that there are other other paths available, that there are other people who care and who have been where they are, and who want to honor them and their experiences. So yeah, we'll walk through these different components, and we have some examples because it's always good to share examples. But I think it's really kind of fun to talk about these different things and share our own experiences. Because yeah, I mean, I know that you all talk to people all the time. You have, I'm sure, witnessed people go through really, really difficult things. And you yourself have also gone through difficult things, and I'm sure you also like have this like kind of felt sense of like what builds a connection, what feels authentic and what doesn't, what actually hurts. And again, like we want to be intentional in how we approach people and shifting away from that like kind of just like response mode and shifting more towards a mode of connection. So validation, again, all about showing people that we see them where they are, that we understand that their feelings make sense. And so validation can sound like that sounds really hard. It makes sense that you're angry. I can see why you feel that way. I'm so sorry that happened to you. A lot of people don't actually ever hear those kinds of things. Like people, and if they're not explicitly stated, like people also, don't tend to show themselves that grace, right? Like people tend to blame themselves a lot for the things that they're dealing with, for the things they're feeling. And it's really important to actually, say those things. Validation also can sound like thanking them for sharing their experiences, thanking them for their honesty, because it can be really hard and scary for people to talk about suicide. Um, that really sucks that you have to deal with that. That's a big one, honestly. Sometimes like that's just all there is to say. Like it just really sucks. And yeah, different ways to reflect back to people. And then on the other flip side, invalidating responses, are any statement that kind of like diminishes what someone's saying, or like overriding, their sense of agency with your own kind of judgment about it. So like you're being selfish can feel really invalidating. At least you're not dot dot dot, like that is I think one of the worst ones that sometimes people kind of bring out in a way to try to reframe or like silver lining it. Like at least you're not like divorced, like at least you're not failing all your classes, like stuff like that. Like really anything that like kind of shifts it away from like what the person's actually dealing with and trying to like tell them how they should feel about something else. That's crazy. Calling people crazy. I mean, sometimes you can say that's crazy in a validating way, like what you're going through is crazy, like the way people are treating you is crazy. So again, kind of depends how you say it. Telling someone they have so much to live for. You really like don't know that. We don't know that that's how they see it. I know exactly how you feel. Can be an invalidating statement because most of the time people, don't know exactly how you feel, there's definitely ways we can share about our own experiences in a way that is vulnerable and connective, without, making claims about like knowing exactly what they're going through or exactly what they need to do, or like making those exact comparisons. Trying to tell someone they were doing so well, before, again, that could be very like shaming, or like trying to tell people like, what they should do, what they should try. Um, yeah, again, there's ways we can share about what has worked for us, and we can share about that in a way that is sensitive without, just imposing. But yeah, I'll pause there. I'm curious, what else comes up for y'all, on the concept of validation? Like, what have you found really effective in your work? Um, or if you have other examples of invalidating statements. Um, yeah, just wanted to pause there.
Well, folks are maybe typing and thinking about a response. The response of you should try a raw food diet, yoga, meditation. I have so many thoughts. I have so many thoughts on how ridiculous of a response that is to so many things that are happening in people's lives. Like, just change your
Mhm.
diet. Like, yeah, there is a food, gut, brain,
Mhm.
connection, right? But also changing to a raw food or vegan diet isn't going to change the trauma of sexual
Yeah,
assault that happened to you, right? Like
exactly.
it's just so silly, so silly.
Yeah, it's silly, but yeah, people do be coming out
Oh
with their
yes,
their unsolicited advice all the
very much
time.
so.
Yeah.
Someone said, "Are
Alexa.
you sure you're not just sad?"
Yeah. That's a great example. Yeah. Because again, like, well, like we can't like put our own perceptions and like definitions of like what that is, like just sad. Like what does that mean to that person? And like, yeah, I think like any phrase that kind of starts with like, are you sure you're not just, or like at least you're not, like that's how like we just get into so many assumptions like so quickly.
And also, like, maybe they are sad. Like, that's also invalidating that intense emotion that
Hmm.
sadness can be for people. Like, sadness, emotions mean different things to different people, and the way people experience emotions are going to differ from person to person. And the sadness of sexual violence can be deep. The sadness
Hmm.
of the life that you thought you were going to live that was, impacted by the assault that happened. Sadness of just so many myriad of reasons, right? Like, yeah,
Yeah.
that's a good example.
Hmm. Any other examples of like, yeah, invalidating? So sometimes it's easier to think of invalidating statements than validating ones, but yeah. Cool. Well, we can move on, but we can definitely. Oh, we got one. Yes, Carrie says just holding space and sitting in silence with someone. Definitely. I think that yeah, there's a lot of yeah, kind of nonverbal ways to validate too and to create that safety. Um and yeah, like body language, tone can do a lot. And really like yeah, making the time to really like sit with someone and have that conversation can be very validating. Um sometimes people take a long time to kind of articulate what they're feeling. Um Sometimes people have to like struggle through things, but there's a lot of ways we can like show them that we're there, that we're listening, we're not going anywhere. So yeah, thank you for naming that too. Right. Let's go on to curiosity. So, curiosity over judgment. And like curiosity is about asking questions that can really open up for further conversation. And we're trying to get beyond just like kind of like the checkbox questions, because I think a lot of people feel that way, unfortunately, when they are going through like clinical risk assessments. They can, kind of feel that the provider's like trying to like get through these questions. And so sometimes we do have to do those. Maybe there are protocols like that in your job. And I'm not trying to say that those kinds of tools are wrong, but they definitely have like value. But do they actually provide the connection that people really need? Um, that can depend on how you deliver them, right? And so that's where I think like we want to think about our tone when we ask questions, when we can like kind of open up space to get beyond just like the checkbox questions, so that people have more space to really tell their story, to elaborate more, so that you can get a better sense of what this all is meaning to them. So yeah, curiosity could sound like, what's going on, what's underlying this, right? How long have you felt like this? Um, what would you like your life to look like? I think like that's a really big question, and one that people are not asked often enough. Like, how do you define recovery? How do you define improvement? And similarly, like, is there something you need to let go of or something that needs to end in your life? That I think can be a really good way to kind of reframe the question, like, are you thinking of suicide? And again, I also want to say that like it's okay to ask, and it can be really helpful to directly ask someone, are you thinking of suicide? Like you cannot plant the idea in someone's head, and in fact, like directly naming these experiences actually create so much more safety than like dancing around it. And if you're able to like directly say that, and if you say it in a way that is compassionate, where you're giving them space to really like, answer the question, that can do a lot for people. Um, and like there are some nuances I think across certain cultures where like that phrasing, like, are you thinking of suicide, doesn't necessarily like hit in the same way, doesn't necessarily resonate with people. So I think like a good way to reframe that too is like, is there something that needs to end in your life? Is there something that you wish would die in your life? Like sometimes that can also resonate with people, get people thinking about it a little bit differently and a little bit more willing to share. Um, yeah, is there something you need in your life to get through this? Again, trying to get people to identify like what their needs actually are, so that we're not just assuming what their needs are. What has given your life meaning in the past? Again, trying to help people think about like the bigger picture, trying to think about times where they maybe didn't feel this way, and what can we learn from those times that we can apply now. Um, are there any people or animals in your life that you still feel close to? I think like those are um, also good ways to kind of learn a little bit more about what people find comforting, what people find to be um, safe, what people find to be like meaningful and fulfilling. Um, yeah, I'm curious what other questions you guys might ask someone, like, or like the kinds of questions that you have found helpful, like either like that someone in your life has asked you, or maybe questions that you have found helpful for like opening up a little bit deeper of a conversation with the people you work with.
I think when people share that they have like a pet in their life, that is that might be the sole reason that they're not choosing to die by suicide, right? Like that, and not invalidating. that they just
Hmm.
have a pet in their life, um,
Hmm.
is super important.
Hmm. Yeah, I think like that is one of like the biggest recurring themes I see in the alternatives to suicide groups that I help facilitate. Like it is always people's pets. Like that is at the top of their list for staying here. Um yeah, and so yeah, I think like there's a lot of opportunity there to talk with people about like, what that is like for them. Like what do they love about their animal? Um like like what has that relationship like done for them? And yeah, yeah, it really hurts when people like kind of diminish that. Like animals are just as much our family, are just as like, precious to us as people.
Yeah.
Well, we can move on from that one. But yeah, there's lots of different ways to kind of ask these questions. Again, I think it comes back to like really taking a curious approach. Open-ended questions are, a good way to like let people, kind of elaborate more deeply. So vulnerability is the next component. So vulnerability is about that common humanity, demonstrating the power of I statements to establish a we. And so what that means is like, sharing a little bit about yourself, um, in order to show someone like where you have common experiences. Um, and I think vulnerability is important too because it's actually like kind of goes against the way that like a lot of clinical providers are trained to like be be this like kind of brick wall, like not talking about their own selves. And that like can feel very like I don't know, it can just feel very disconnected to people. Generally we trust people more when they share a little bit about themselves, when we don't feel like we're just talking, to a brick wall. And by sharing a little bit in a way that is just mindful and intentional, we can like make space for deeper trust and connection. It shows them that we trust them as well, and that can be reciprocal. And so ways you can kind of share a little bit about yourself, you might say like, sometimes when I've been angry it was because someone hurt me. Is that something you relate to? Like I think like that's always a great um way to try to build that connection, like share a little bit and then ask like, is that something you relate to? Like does that resonate? Um does that sound like similar to what you're going through? You can always like share a little bit and then ask and check in, right? When I was growing up, I was told you had to be tough all the time. It took me a while to figure out what didn't work, that it didn't work to hold everything inside. When my relationship ended, it was so painful. It felt like someone had died. So like being really honest about the pain and the hurt that you have gone through, and sharing upfront. You can share, to the degree that you are comfortable. But like it's yeah, it can be again validating. It can be a way to show someone that they aren't alone and that that the person that they're speaking to like really is like appreciating them as a whole person. Vulnerability also includes honesty about your own emotional state, and I think that that can also kind of help take some of the pressure off of us when we're in those conversations. It's okay to just say that you don't know what to say right now, but remind them that you're here to listen. It's definitely okay to tell someone like, I would feel sad if I never saw you again. Again, we get a lot of really understandable emotional reactions and like things stirred up when we hear someone talk about suicide, when we hear someone talk about wanting to hurt themselves or not wanting to be here. And so we should be honest about that. Like we should be honest about what comes up for us, um, and just not do so in a way that is like imposing on them, in a way that's not like making that like necessarily like their problem to fix, or like we don't want them to feel like threatened by our emotional responses. So yeah, we can name plainly that we feel scared, that we don't know what to say. We can say like, I don't know like if I'm going to say the wrong thing. Like this relationship means so much to me. This community and everyone in it is like family to me. I don't know, but like I'm committed to listening to trying to figure this out with you. Like I think like that can go a long way for people. You might name that you have some tough memories from the past coming up right now. I'm going to take some deep breaths and try to stay in this moment. I think like it's definitely okay to just ask like for a moment or like take a minute to say like I'm really sitting with what you said right now. Like I am trying to process this. Like I am just so struck by what you shared and I just like I'm really feeling for you right now. So it's okay to say those things and to really take that moment, to take that pause. That can also be a way just to kind of like ground yourself, to be more present. Because when we allow ourselves to get really swept up in the emotion of that moment, like that's how we can really move into a place like of a place of urgency, and that's where we can kind of miss out on those opportunities for connection. Any other thoughts about vulnerability? I'm curious if it brings up anything for people. Maybe in some of the roles you're in, you don't have that pressure of like, never self-disclose, never share. That could be a really hard place to be in too if that is like, kind of the way you're trained. I think a lot of mental health professionals kind of struggle with that concept. But yeah, just curious if there's any questions or thoughts about vulnerability and what that looks like in your work.
Your comment about folks in the field being taught that self-disclosure is inherently bad. And, there's pros and cons to it, right? Like we have to balance how much we do disclose, but then also making sure to reframe it back to the person that you're working with. Like there can be power in showing, like you said, Erica, the person that you're working with that you are being vulnerable and honest in this moment and opening up, especially when you're trying to get someone to talk about feelings of wanting to die or die by suicide, right? Like there can be a lot of power in moving the conversation along with that.
Hmm. Yeah, yeah, and vulnerability is really uncomfortable sometimes. Like that's one that I kind of struggle with in the support group space. Like it can be hard. Yeah, Jenny says we are encouraged to ask ourselves why we feel the need to self-disclose prior to disclosing. Yeah. Yeah. Yeah, and it's good, right? Like it's good to reflect. Like it is certainly like something we want to be intentional with. I think in this case it's like, yeah, why would we self-disclose? Because we're trying to build that trust. Anna says 100% agree. We can still hold our boundaries with clients while still being vulnerable in order to build trust. Exactly. Yeah. Yeah, it's a bit of a balance. Yeah, and it brings up a lot in us too. Like, we're trying to show up and be that source of support for someone. Uh, we don't want to take up space. Like I think that's a common kind of thing that can hold us back. Um, but yeah, again, if we're moving from the intention of like trying to build a connection, trying to build trust, I think that we can deliver it in a way that is mindful. And that's where, yeah, I always just kind of fall back on like sharing a little bit and then like, is that something you relate to? Like, or you could even ask like, I went through a similar experience before. I had to navigate these different resources. Like, would you like to hear about that? That could also be a good way, like kind of give someone the option. And then you can elaborate more. Cool. Let's go to the last one. So community is the fourth component of VCVC. So community is about being a bridge, not a life raft. So we want to, again, like help people see that they're not alone and help people get connected to community. Um, and just kind of again like reframe things in a way that like helps them think about like where they might go next or like what might be worth exploring. Um, and so we can ask questions to kind of again explore someone's concept of community, what is available to them, or like what they like want to seek out. So we can ask questions like, are there ever times you don't feel like dying? What are you doing in those moments? Are there people in your life you still feel connected to? Is there anything that gives you a sense of purpose? Are there things you want to do before your life ends? That's a big question we talk about a lot in the support group space. Yeah, what do you hope to do? Like, okay, like if you think like um this is what is this is the best solution to you, like what else do you want to do before your life ends? And the things that people share can be so interesting and can be like a whole conversation in themselves. And when we actually explore those things, like again, like that can kind of reframe for people like where they want to go next. That can sometimes move them out of that space of that space of like fixation on dying and more towards like, moving towards the things that actually like give them like purpose in their life. And so there's all different kinds of communities that bring people meaning. So spiritual communities, social justice organizations, sports, reading groups, music, martial arts. Like there's so many different things. Um, and again, I think it's really interesting to talk about this with people because it just again kind of expands our idea of like what recovery really is and like that like what does a life worth meaning really mean to that person. And another hard reality is that a lot of people don't have community, and like that is also, I think, an outcome of the society we live in. Like there are a lot of barriers to accessing community for people, physical barriers, financial barriers, um, social barriers, and so there's definitely like some opportunities to support people in thinking about how they might overcome those barriers to connect with these different communities. And again, these are not like traditional like mental health interventions, so to say, but social connection and community and belonging are some of the strongest protective factors against poor mental health outcomes and against suicide. So yeah, we just, it's going to look different person to person. But if we approach like with curiosity, with an intention to like help support someone in finding a way to access these things, that can be a huge opening for helping people get through these really difficult times. I'm curious if that brings up anything else for people, anything on the concept of community. Carrie asks, is there research data on in-person connection versus online communities? Yeah, that's a good question. I think that again, both can be really meaningful for different people. And on the flip side, like both can come with their own challenges, their own barriers. Like I think like again, it kind of depends on the person and like where they're coming from. For some people, like the online communities are their only source of community, or that is like the most accessible to them. And that's valid. Like even if that's not something like we personally relate to, but that's a very much a real thing. Um, and yeah, sometimes online communities can also be kind of harmful in their own ways. And so I think yeah, I know that there's lots of research in general about like social connection, about like social media as well. I mean, there's so much out there with like youth and social media. Personally, like I don't think that like we should like put either one on a pedestal necessarily. It really just depends like which it depends like how people are accessing it and like what it means to them. But yeah, very good question. Uh, yeah. Any other thoughts or questions about community? All right, I know we have 15 minutes left. We got a couple more slides just to wrap up. Um, Also just want to touch on like how to close conversations about suicide, because again, that can also be really difficult. Um, so when we're closing out conversations with people, we can continue to use the VCVC like framework as we wrap it up. Um, if we can make time to reconnect, whether that's by phone or in person, only if that's something that is realistic. But that can be, I think, a good way to close again, just to kind of help the person see that you're still like committed to showing up for them, that this conversation can continue. Asking future-oriented questions like, what are you doing tomorrow? Or like, what are you going to do after this meeting? Um, Again, just trying to help people frame past this like moment of despair that they're currently in. You should reflect on your own needs after an interaction is over, own your own fears and get support for them. If you feel, you know, uh, like that was really hard, like that conversation brought up stuff for you, it's definitely okay to go to a trusted person or colleague, or maybe you have a supervisor that you can debrief these things with. I think that that's really helpful. Remember resources that are available, such as peer respite and warm lines, and share what you know about them or explore them together. Again, helping people see that there's other options available. We don't want, we don't want to necessarily overcommit to people either and promise or imply that we can always talk about this with them anytime they're struggling with it, but we want them to have, options to turn to for support. And yeah, grounding the conversation in community. Again, as you kind of wrap up, like final reflections. So, like, what do you think you need the most to get through this? Like, what do you need the most to get through the next day or the next week or the next month or whatever that might be? And then, yeah, just some other examples to kind of illustrate VC as you close out a conversation. So, um, you might kind of wrap up with like thanking them again for what they shared, kind of summarizing, reflecting back what you heard that they're dealing with. Curiosity, like I'm wondering if you have thoughts on who or what might help you get through the next day, or like what's going to help you get through this until we meet again. Vulnerability, so being upfront about like how much time you have in that conversation, vulnerable and honest about like how you're feeling, like we only have 10 minutes left together. I'm a little bit worried, but I'm glad we had this conversation. And then community might sound like I'm wondering if you'd be interested in checking out an alternatives to suicide group where you can talk more in depth with other people who have had similar experiences. Or maybe you'll link that to a different resource that you're trying to help them get connected to. Like, I'm wondering if you'd be interested in checking out this, this reading group that's happening in the community. I'm going to share you the info. Maybe, if it's appropriate, like maybe you would check out a resource with them together. Yeah, just again, helping them kind of think about like the next steps that they can take to continue to find connection, to continue to like work through these feelings and experiences. Some examples of how not to close. Again, just want to kind of name some of these might sound kind of silly, but again, just kind of want to point out like what can feel invalidating, what can be kind of unhelpful. So like don't say like I need to leave, I need to go use the bathroom and then call the police or 911 on them. Definitely do not recommend calling for intervention on people without talking to them about it, without being upfront, without getting their consent. We don't need to close in ways that are like, overcommitting or like overpromising or disingenuous. Like, don't worry, we got this from here. Or like you can call me 24/7. I mean, we really I don't think anyone is really available to support someone 24/7. I know when I was younger, like especially as like a teenager and a young adult, like definitely got in situations where I yeah, where certain friends like did think that they could call me at any time. And I overextended myself to try to like meet them every time. I think a lot of us have had kind of similar feelings. So we want to be honest about like when we are available for people and not overextend. Um, yeah, I definitely don't recommend trying to force anything onto people. Like I need you to sign the safety contract, or you can go to this resource voluntarily, or we will have to commit you. Anything that takes away people's choice, I think generally makes situation worse for them. Even though again, we want what's best for the person, and sometimes that can lead us to kind of trying to control the outcome, the control the situation, control what someone chooses to do next. But the reality is we cannot control what people do. It is not our responsibility to make sure that a certain outcome happens. And we need to try to relinquish some of that urgency and that control so that we can really actually help that person get the space that they need and get the resources and the connection that they need. And yeah, don't want to place any more blame or shame on people. Like, I'm counting on you to be safe. Don't let me down. Don't do anything stupid. Yeah, again, like, let's just try to, again, be validating, be reassuring, without overcommitting, without placing judgment. All right. Last couple slides, and then I'll open it up for any other questions or thoughts. So yeah, what we just went through was like a super abbreviated version of a much longer training. I also give that holding space presentation in a much longer format in a couple hours. So again, if that was a lot of information, it's because it was a lot of information, and I wish that we had more time to really dive deeper into things. But if you're interested in this topic, there's a lot of other really excellent resources out there that will allow you to do that. And so again, I'll make sure you all have these slides, but these are some links to different trainings. There are some that are self-paced, like Be Sensitive, Be Brave. There are some that are like 1 hour, like QPR. There are some that are like virtual, like Wildflower Alliance. There's some that are in person as well. And so we have, yeah, a lot of different resources linked on our website. Definitely recommend checking these out. And yeah, I'm always happy to answer questions too. If you have questions about your role or your organization, like what kinds of trainings might be appropriate for you. Because some are more geared towards like clinical, like mental health providers. Some are geared more towards like other kinds of advocates and other kinds of like peer support. And so yeah, always happy to talk about like what's available and what might be a good fit for you and the people you work with. And then, yeah, again, I hope that y'all will stay connected to PSW. I think that it's really important that we bridge the space of sexual violence prevention and suicide prevention. So definitely recommend signing up for our e-newsletter, coming to our conference in the summer. We would love to see you. There's going to be continuing education credits. I don't know if I said that earlier, but with NASW, which is social work, and NCHEC, which is community health educator, continuing ed credits. So yeah, please do come out to that. And yeah, check out our virtual resources as well for suicide loss support, and for attempt survivors. We have lots of different like readings and articles, but also online support groups and links to other like warm lines and resources that people can call. Good to have these things on hand so that you can share them with people you're working with. So again, they have other things to connect to when they're not directly working with you. So in summary, suicide is a public health issue. It's not just about mental health. There's a lot of overlapping risk factors with sexual violence, and there are a lot of questions of power imbalances involved too. But we all have a role to play in suicide prevention. We have a lot of ways to intervene across all settings and populations, and absolutely anyone can hold space for those thinking of suicide. You don't have to be a mental health professional. You don't have to be an expert. No one is, frankly. But any one of us can be a supportive and a warm place for people to explore these things with. And that's really how we can create safety for people. All right, I talked for so long. Now my head is spinning. Does anyone have any questions or thoughts or anything? Yep, I will send the slide with the resources. I'll send you this whole slide deck so y'all have it. I'll send that to Angie after this, and I think they'll be able to send it to all you. But yeah, definitely want to encourage any questions that you all have. I know this can be a really big topic. It's not a topic that most people get any education on either in their formal schooling, which is a huge issue. So no silly questions.
I'm going to stop the recording in case anyone has any questions that they'd like
Sure.
to ask off the recording.